technology being used to treat knee pain and osteoarthritis. Joining me is Dr. Barry Hatch, the clinic director from Laser Knee Institute. Good morning. Thank you for joining us.
Thank you for having me.
Now, millions of Americans suffer from chronic knee pain, and they think they need a full knee replacement. There's only 4. We're talking about a high-powered laser here today, and there's only 4 in the country, and your office, your institute, has one of them. Tell me about this laser, and is it FDA approved?
It is. It was actually FDA approved in 2010, and I was certified back in 2010, and we've been using it here in Arizona. We're fortunate to have one here in the Valley of the Sun here in Arizona. My colleague, Dr. Brad, in LA, treats a lot of professional NBA basketball players and so forth, and so he basically found out that I relocated out here, wanted me to get certified so I can treat some of the pro baseball players during spring training. And so that's kind of how it originated, getting it out here in Arizona.
Now, you have patients that fly from across the country to your institute for this procedure. Tell me, who is the candidate, and how does this laser work?
Well, good questions. I have patients that fly in from Chicago, from Texas, even Hawaii, to have this procedure done because they are, a lot of them are a candidate for a total knee replacement surgery.
And they don't have to be pro athletes for this. And this is your baby boomer, your average man.
Exactly, exactly. A lot of your baby boomers that have chronic knee pain, they're looking for an alternative option other than risky surgery. And so they come in, some of them 3 or 4 treatments of the procedure, and they're done. It's amazing.
Now, what makes this high-powered laser so unique? Tell me about this.
Well, there are a number of things. One of the main things that really sticks to my mind is the number of studies that have been done in Italy.
And we're looking at it right now. That's it.
Yeah. In Italy, the Italian National Research Council has done numerous studies, and the studies have shown that the laser, in a nutshell, has been able to regenerate articular cartilage, which is phenomenal for your osteoarthritic and your degenerative joint disease knee patients. It gets rid of inflammation, stimulates the damaged cells. It causes a whole cascade of cellular activity, which decreases the pain in the patient tremendously, accelerates the healing of the damaged tissue and the repair of the tissue. So all those things are phenomenal. Even your injured workers, a lot of your injured workers are on a lot of heavy pain narcotics, and we're able to reduce the amount of pain medications that they're on because of how phenomenal this laser is in reducing the pain as well as regenerating damaged tissue.
Now, typically, how long does one of these procedures take, and is there a lot of pain involved?
No, there's no pain at all. It is a hot laser. It is actually the world's most powerful therapeutic laser. Wow. It's 3,000 watts. Just to kind of give you an idea, some of your other therapeutic lasers, they're about a 90 milliwatt in strength. So you're going to get about maybe a centimeter in depth. This laser, 3,000 watt laser, is 300 times more powerful than any other therapeutic laser on the market. I brought this here. I forgot I had it. This kind of demonstrates, this is a 5-inch marker. This is the depth of penetration that we can reach with this high-intensity laser.
Wow.
And a lot of your other lasers are about a centimeter. And so if you can't reach the damaged tissue, you can't affect it.
You can't affect
and
it
so,
and get healing.
Yeah, a lot of your deep pathologies, your degenerative arthritic pathologies, hip, knee, and so forth, are deep. We need to get through the soft tissue, the muscle, and the fascia, and so forth, to reach those injured tissue cells. And then when we reach them, amazing things happen.
Now, what kind of conditions do you treat at the Laser Knee Institute?
Well, like I said, we treat a lot of athletic injuries, you know, from your club soccer players to your pro injuries to your injured workers who are in a lot of pain. But I would say about 80% of the patients that we treat at the Laser Knee Institute are your average mom, dad, you know, your baby boomers.
Baby boomers.
Exactly, that have, they've been told by the doctor that they have bone-on-bone knee pain, and so.
And let's look at this photo right here. I mean, is that, quickly, can you tell us, is that kind of a typical of a baby boomer coming in, just the eroding cartilage over time?
Exactly, exactly. So what's happening here is we have an arthritic knee where the cartilage is the white, kind of pearly white surface there with kind of the erosion there the arrows are pointing to. And so they come in, I'll do a consultation with them, look at their MRIs, the MRI report, go over that with them exclusively, you know, extensively, and then that's typically what we see here. And so we get them treated, and it's amazing. They're able to avoid the risky total knee procedure altogether at times. For
those people out there who are saying, you know what, that's me, I don't want to get a full knee replacement, and you were speaking of the consultation, you have a special offer for our viewers out there. Tell me about that.
I do. Well, we're offering a free consultation, a free MRI consultation or X-ray review. one free follow-up treatment, and that is for those patients who qualify. We have to do an extensive evaluation and make sure they qualify as a candidate. And if they do qualify as a candidate, we offer one follow-up treatment as a candidate.
All right, Dr. Hatch, thank you so much. Your location is in Tempe. So, of course, for more information on Laser Knee Institute, please go to their website at laserkneeinstitute.com or call the number you see right there on your screen.